Hi, I'm Arundhati Gupta. I'm the founder and CEO of Mentor Together, which is a national youth mentoring focused non-profit organization in India. Our vision in Mentor Together is simple, that a young person anywhere in the country should be able to access mentorship through professionals that have life-changing experiences of their own. I set up the organization a couple of years out of university because of the transformative role of mentorship in my own life. I was set on a career in business and finance until a mentor, someone I met incredibly fortuitously, reached out and helped me discover that I actually had a lot of skills to offer my city and my community. And that experience just transformed my life as a young person. And the idea that mentorship is not an absolute essential part of growing up for all of us was something we felt we had to change. So we set up Mentor Together to ensure that we could pay forward mentorship and ensure it was a part of everyone's life experience growing up in India. Today, Mentor Together runs a large digital mentoring program that works with over 40,000 young people across the country, with over 220 universities and 40 corporates that have signed up with us. And young people anywhere in the country can access this program. And we provide it completely free of cost through the support of different types of corporate social responsibility initiatives. And the community of mentors that we have on the app is about 15,000 people. Last summer, as part of the Japan-India Transformative Technology Network, which I'm a fellow of, we convened in Salzburg, and we had fellows from so many different thematic areas, so many different interests, and many of us convened on a common passion around mental health. And what brought Anushka Kelkar, my co-founder in this initiative, and I together was our passion and belief that everyday relationships have the power to offer transformative mental health, positive mental health. And that's what we've been working on for the last year. So our project looks at working with community mental health champions, which is what we call them, but really volunteers. This could be anyone above the age of 18 who's interested in providing and learning the skills of how to be a helper, someone who's trained in providing positive mental health. To be very clear, we're talking about mental health support that is subclinical, that is something that does not require speaking to an expert, because none of the volunteers we have are experts, but are people who have a lot of skills and abilities to provide such services. So what our project looks to do is to take volunteers and provide them the tools and the skills via a digital platform to become equipped to deliver these services, and then match them to young people who are requiring such services. And we do all of this through a technology platform that we've built. Specifically in this project, we're focusing on the training that these volunteers will need. So in India, there's a striking shortage of professionals providing mental health services. There's just very little access to such services if we limit it to professionals. So we are looking at what's technically called lay helpers, and there's incredible evidence showing us that today such lay helpers could be very effective resources to increase access to mental health services and provide very efficacious, that is, things that actually are effective for the end users. So that makes us different from most of the other approaches to increasing access to mental health. Additionally, we're looking at how a digital platform can rapidly scale the access to training for such lay helpers, because that's the only way that a lay helper anywhere in India will be able to get trained and skilled and provide their services to another young person. As a third thing, we're highly evidence-based and research-backed. We've looked at what is the best in training, including ideas of just-in-time training, which is about, instead of doing a lot of upfront training, ensuring training is provided in small bite sizes exactly at the point when someone may be requiring that knowledge and information. And we're also trying to now integrate large language models to ensure that our training approaches have more conversational abilities to provide the volunteers the help when they need it.
Hi, I'm Anushka Kelkar. I'm the co-founder of Therapize, a mental health care startup where we work with 200 plus vetted therapists all across South Asia, and we've connected more than 30,000 care seekers to the right therapists for themselves. I'm also currently a master's student studying AI and ways in which it can be applied to the health tech space. Last year at the Salzburg Global Fellowship, Arundhati and I got together And something that really stood out to us was that through both our experiences, we'd seen two clear things. Number one, more people are struggling than we know of. And number two, more people are willing to give help than we know of. Both of us had personally experienced our own sort of fair share of losses, and we both experienced how mental health is more than just a one-time therapy session. It's an everyday investment you make in truly cultivating communities and a life that feels joyful to you. But right now, we felt like there weren't that many spaces in which people who don't have resources can get the support they need. This is why when we came together, an idea that both of us felt really excited by was using a model where we get community members. These can be your friends, your parents, your cousins, your co-workers, who are trained to kind of understand how they can better provide help to people who might be struggling with low-grade anxiety or depression or clinical issues that aren't very severe. While I was working with Therapize, what I realized that was really unexpected to me was that not only does India have a huge shortage in actual clinical support right now, but there's also a high rate of burnout for professionals. So what really I think is the need of the hour is to equip more people to give the kind of care that will transform millions of lives. So when Arunati and I came together, what we thought was really compelling was bringing together two things. Number one was making mental health care accessible, low cost, and low stigma. Because so many people are hesitant to actually go to a clinic or actually in person kind of show up, we thought it would be effective to have a WhatsApp-based chatbot that would help train volunteers and help them to help others. So the way this works would be a simple API integration, leveraging large language models, and we see this to be an extremely cost-effective way of scaling kind of a large volunteer network that can then touch millions of lives. In terms of what we're looking for support on with this, we really would love to collaborate with more technologists, designers, and get more perspectives on the various user journey touchpoints at which we could bring in other folks to make mentorship as well as sort of the training of actual volunteers a much more joyful experience both for volunteers and ultimately for care seekers.